material. About the etiological agent of this disease. In front of you can see the electrogram of human immunodeficiency virus. And this virus belongs to the group of retroviruses group. And the name retrovirus indicates that the name retrovirus indicates that in the infected cells, you know that in normal condition, the presentation of the way of the presentation, genetic information is from desoxyribonucleic A to ribonucleic A, and then the synthesis of protein. But in infected cells, we register the retro presentation of genetic information, and that's why the name is retroviruses, or return presentation of information, return. Then, about the very interesting moment, why up to this moment we have not the vaccine against this virus. I'm sure that you are informed that a few clinical trials about the presentation of vaccines against this virus, but these vaccines up to this moment are not effective in African countries such as Kenya, and the clinical investigations indicate that this vaccine was not active in the prevention of this disease. And question why? And now I explain you. You know about the vaccination, and the vaccination, you know active vaccination and passive vaccination. I'm sure that you know this information from the chair of immunology and microbiology, and the basis of the active vaccination, when you bring the low virulence microorganism into the microorganism, and then formation of antibody against the antigens of this microorganism. Because the principle of elimination of antigens, because the antigens is responsible for the formation of infection process. That's why the aim of the prevention is elimination of antigen. We can eliminate the antigen by two ways. First is process of phagocytosis. You know about this process, and the cells which are responsible for this process are neutrophils and macrophages. First is this way, such as the process of phagocytosis, and second, but I need information about what structure of antigens is responsible. You know that the responsible for the antigenic realization of antigenic potential is antigenic determinant on the surface of antigens, and that's why the principle of elimination in the second way. First is phagocytosis. Second is the neutralization of these antigens determinant on the surface of cell walls. And by the way of the formation of complex between the antigen and antibody. And after the formation of this complex, you can register the elimination of antigens from the pathological process. And that's why it's very important to have antibodies in organism. And presentation of these antibodies may be by two ways. First is active synthesis of these antibodies, or passive vaccination, when you bring in the organism the prepared antibodies. About the active vaccination. Why active vaccination? You must bring in the antigen, but avirulent antigen, and then formation of antibody, and these antibodies are prepared for the formation of this complex. But in situation of HIV disease, it's more difficult because the structures of antigens on the surface of virus is very changeable. Very changeable antigenic structure. And if the antigenic structure is changeable and very changeable, it's impossible to realize all possible antibodies which may be to be prepared to form this complex, such as antigen and antibody, because this antigen and this antibody must be identical, such as key and lock, because in other situations it's impossible the neutralization of these antigens. And because this antigenic structure of this virus is very changeable, that's why very difficult to form all possible variants of antibodies. And that's why at this moment the science is unprepared to the formation of this kind of antibodies. And that's why we have problem in the synthesis of the effective anti-HIV vaccine. Passive immunization. We must prepare the antibodies in the factory and then bringing these antibodies in the organism. It's impossible at this moment. Now about the next moment. Next moment, the structure of this virus is very changeable because the size may be changeable. You can see normal sized HIV disease virus, and this is minimal form. We can describe the giant form of this virus, and that's why the change in the structure, change in the size, the result of this change is the change in the pathological potential of these viruses. It's absolutely right, because you know about the egg transformation, you know about the formation of cysts and other possible forms of bacteria, and you know that the pathological potential of bacteria is changeable according to the morphological structure of this virus. In fungi, you know about the spores and mycelium, these two the forms of this microorganism, and change in pathological potential. Similar is here. Next moment for the understanding of the mechanism of formation of this disease. Now, our organism must be protected, and the protected from the question from first infection agents, because after the penetration of infection agents in organism, we register the onset of process of inflammation and the formation of infectious process. The mechanism of defense of organism in this situation is the process of phagocytosis. And you know that the cells which participate in this process are first neutrophil, macrophages. But this process must be under control, and the cells which are responsible for this control are two: the helper and the suppressor. Because the helper is the cell which turns on this process, and the suppressor is a cell which turns off this process. That's why these four cells, the helper, the suppressor, macrophage, and neutrophils, are responsible for the realization of the process of phagocytosis. And if we can imagine in organism this situation when these cells are not effective, in this situation we wait formation of different infection diseases. And HIV disease is characterized by this moment, that we wait formation of different infection infection agents in organism, because these cells are effective, are not effective in this situation, are ineffective in this situation. Second moment, you know that constantly in organism we can register the process of mitosis and process of meiosis. And during this process of mitosis and meiosis, we wait formation, sometimes we wait formation abnormal cells. And the name of these abnormal cells is atypical cells. And these atypical cells are the first cells after which you wait the formation of the process of oncogenesis. And the process of elimination of the cells is responsible with activity of cells named which is natural killers or killer cells. These natural killers, and the name killers, their function is killing the atypical cells and eliminate them from the process in organism. That's why if we have the situation when these cells are ineffective, we wait formation of different neoplastic processes in organism. And HIV disease is characterized by this principally important moment. We wait formation of different neoplastic process, and we wait formation of different infection process in organism. And now I present you this possible forms on this slide. You can see that we wait formation of different forms of neoplasm. We wait formation of different infection diseases, and we wait formation of miscellaneous dermatosis in which pathogenesis participates the different defects in immune system. And that's why we wait formation of this kind of diseases such as miscellaneous dermatosis. And according of this material, now I present you what the diseases is more often you can register in the duration of these diseases. Neoplasm. In this group, we can present you the disease, and name of this disease is Kaposi sarcoma. It's very interesting who was Kaposi. Moritz Kaposi was very famous Hungarian dermatologist who lived in Austro-Hungary Empire, and he lived in Buda, and he described a few diseases. You know, one from this, it was eczema herpeticum, and second is Kaposi sarcoma. But why name Kaposi? Because in your textbooks you find the name Kaposi. Because Hungarian names, the suffix si, we can present, speak such as Kaposi. Kaposi, Sarkosi, Rakosi, but in English textbooks, English language textbook, you can find the Kapo si suffix, but not shi. But we use the name Kaposi. Moritz Kaposi describes this disease, and the name of this disease Kaposi sarcoma, SK. But this disease isn't true sarcoma. The other name and classical name of this disease is angioreticulosis of skin. And why angioreticulosis? Because angio we can translate from Greek such as blood vessels, and reticular because you can find the change in reticular stroma of blood vessels. And that's why more right name, more true name of this disease is angioreticulosis of skin. And this disease in classical variant, because now I present you the information in classical and in patient with HIV disease. In classical forms, you can find this disease predominantly in elderly patients, which age is more than 65-year-olds. If you find this clinical presentation of this disease in young person, if you find, you must imagine that it may be clinical signs of HIV disease, such as in earlier presented patient. About this moment, you can see the formation of the papule, and papule predominantly on low extremities. The color of this element is violet. Why violet? Because angioreticulosis, and you can find venous blood in this situation, and that's why the color is violet. At the onset of this disease, on low extremities, in classical variant, you can see without any subjective complaints. It's very principally important moment. Without any complaints of the patient, itching, pain, no, because it's very important in differentiation from lichen planus, because you know that lichen planus is characterized by possible formation of violet color papules, but lichen planus is characterized by very intensive itching. In this situation, itching is absent, and that's why it's very principally important moment. Then, you can find only isolated papule at the onset of this disease, and more later, you can see the formation of plaque on the surface of the skin, and you can see specific plaque on the surface of the skin on low extremities. Differentiation from melanoma, because in the situation of melanoma you can see this dark violet color elements, and no differentiation in this situation by the dermatoscopy method and other cytological methods of investigation. In elderly patients, these clinical signs. In patients with HIV, you can register the similar multiple papules, but they are disseminated on the skin surface. Disseminated form of this disease. You see at this clinical case multiple papules, violet, dark violet color, which are disseminated on the skin surface, not only on low extremities, but you can find this element on whole body, maybe numerous or non-numerous, but you can see the multiple elements on the skin surface, on whole body of the organism. Next, the similar elements you can find on the back, on the chest area, on the back area. You can see this element without itching and papules. Then you can see the elements on the face, this element on the face at the onset of this disease. Then you can see the element on the eye here, and then very often we can find the element on the membranous, on oral cavity and genital area. You can see the ulceration of this element, of ulceration of the papules on the oral cavity in this situation, and you can see the formation of multiple papules on the surface of the genital part or on the penis. And our patient has the similar clinical signs, these papules or the formation of the genital part. Now, don't forget that this papule may be indication of the presentation of syphilis, because you know that the secondary stage of syphilis is characterized by possible formation of these multiple papules. And in this situation, you need in differentiation. These papules are syphilitic genesis, or these papules are HIV genesis. That's why differentiation by blood investigation. Don't forget that very often you can find the coincident presentation of these both diseases in the one patient as in our patient, because it may be positive result for the determination of treponema pallidum antibodies, positive in our patient, and it may be positive or HIV disease antibodies positive in our patients. That's why don't forget that these both diseases may be presented at the same time. Don't forget about this because it's very difficult to differentiate these two diseases from each other. Now, the next clinical signs which we can include in the group of the neoplasma is cancer of the rectum. Why? Because you know it, you are well informed that the high-risk group of persons which we can include in this group are homosexual men and sexual intercourse per annum, maybe as a factors of aggravation, of exacerbation of the membranous of the rectum, and maybe factor of initiation of formation of cancer, predominantly in persons with immunodeficiency, predominantly is persons with numerous sexual intercourse per annum, and that's why we wait formation of this disease. That's why these two diseases, such as Kaposi sarcoma and cancer of the rectum or anus, we can include in the group of neoplasma, which are the characteristic diseases of this disease, and don't forget about this possibility. About the other diseases, neoplastic genesis maybe, but they are not statistically important. That's why we are not included them in this group, because we think that it's more easy for understanding these two principally important diseases, such as Kaposi sarcoma or angioreticulosis, and second is cancer of rectum or cancer of anus. Next moment is the diseases of infection genesis. In this group, diseases of infection genesis, the first is viral dermatosis. Now, from this group, we can present you herpes simplex. You are informed, you are well informed about this disease, such as herpes simplex. You know that this disease is viral genesis. You know that this disease is characterized by possible formation of multiple vesicles, grouped vesicles. After the opening of these vesicles, you can find multiple erosions, which are covered by the crust, and after the removing of the crust, you can find the hypopigmentation and scarring of the surface. But what is the difference between the herpes simplex in classical variant and in patient with HIV disease? In HIV disease, you can register unusual localization of this disease, unusual localization of herpetic elements. You can find elements in perineum area, you can find elements on the pubis, and more other unusual area of localization. Then, duration is longer than in classical variant. Sometimes the duration in HIV disease infected patients may be up to 3 weeks, because in classical variant, you know the duration no more than 10 days. But in this situation, up to 3 weeks. Sometimes we can register in duration one specific moment, that the process is not finished, is not lasted, and you can register the onset of the next recidives of this disease. Sometimes maybe this atypical duration of this disease. Next disease from this group is herpes zoster. You know about the herpes zoster. You know that as a rule we can register only single recidives of this disease as a rule. But sometimes in patients with immunodeficiencies, including HIV disease, you can register multiple recidives of this disease. It's maybe 4, 5 and more recidives of this disease, and if you have patients with multiple recidives of herpes zoster, your patient needs additional investigation for the possible presentation of HIV virus in his organism. And don't forget about this possibility. About the post-herpetic neuralgia. Post-herpetic neuralgia is a specific clinical signs of this disease, but in patients with HIV disease, we wait that this duration is more long than in classical form, is longer than in classical form, because it may be up to 5 or 6 months, and in this situation you must imagine that it may be clinical signs of HIV disease. The next is the possible presentation of, that the etiological agent of the smallpox and herpes zoster is the same virus, and this clinical case very interesting because you can see the first is Kaposi sarcoma element, this Kaposi sarcoma, and multiple elements of chickenpox. This and duration of chickenpox in this patient is characterized by very elongation of period and multiple vesicles on whole body of the infected patient. And this is why the old name of this disease, AIDS, acquired immunodeficiency syndrome. Why syndrome? Because you can register different diseases at the same time. That's why syndrome. But new name is HIV disease. But if we indicate that this is syndrome, we imagine that we wait different diseases at the same time. You can see Kaposi sarcoma, and the second is chickenpox. Next viral diseases is the name is warts. Warts, giant forms. Specific clinical presentation is